glucose test, begin by assessing your patient. Note in particular the condition of the skin at possible puncture sites, such as the fingers and forearms. Look for edema, inflammation, cuts, and sores. Avoid bruised areas and open lesions. The patient should be positioned comfortably in a chair or in a semi-Fowler's position in bed.
This one, but before we proceed, I'd like you to just get up and wash your hands for me.
Okay. I have your blood glucose.
Pinag-wash siya ng hands, no? Normally sa hospital may mga ganang procedure, pero pag the patient, papatayuin ko naman to. So, normally, ikaw na mag-disinfect. Kaya meron yung parang, meron siyang wipes tayo cotton balls with alcohol, no? And makikita mo, chini-check niya yung kamay kung saan part, no? So, kung saan part mo pipirahin na, insert. Okay.
Testing equipment that you'll be taking.
So, ito yung gamit niya, one touch ang gamit.
Keep in mind that many types of blood glucose meters are available. You must follow the manufacturer's specific instructions for the model you're using. Remove the reagent strip from the vial and tightly reseal the cap. Insert the test strip into the meter, taking care not to bend it. The meter will turn on automatically. Check the code on the vial. Use only the test strips recommended for the glucose meter you're using. Some newer meters don't require a code, and others have a disc or drum that contains 10 or more strips. Then prepare a single or multiple-use lancet device. Remove the cap and insert a new lancet. Twist the protective disc off the tip of the lancet and replace the cap on the device. Then cock it and adjust the puncture depth.
Puncture depth.
Apply clean gloves and select a puncture site in a vascular area. In a stable adult, the lateral side of the finger is usually a good choice.
Lateral side. So, pagilid. Normally, nakikita niyo ginagawa dito, di ba? Lateral, dun sa gilid. Yan nandoon ang mas maganda. Okay.
Or to avoid the central tip of the finger. It has a denser nerve supply, and pricking the skin there can be painful.
Okay, so what I want to do now is clean the site there in your finger.
Wipe the puncture site lightly with an antiseptic swab. Hold the area of the puncture site in a dependent position. Don't milk or massage it. Hold the tip of the lancet against the skin at the intended puncture site and press the release button. Some devices allow you to see the blood sample forming. Remove the device. If you don't see a drop of blood, gently squeeze or massage the fingertip until a blood drop forms. Make sure the meter is still on and bring the meter with the test strip already in place to the finger.
Konti lang.
The blood will be whipped on to the test strip. Follow the specific instructions for the meter you're using to be sure you obtain an adequate blood sample. The test result will appear on the screen.
Ang taas. Okay, ang ginagamit nila is milligram per dl. Kasi 146, no? So mataas yun. So what is the normal? 70 to 100. Okay?
The meter. Some devices emit a beep when the blood glucose measurement has been made. Now you're all finished. Turn off the meter if your model doesn't turn off automatically. Dispose of the test strip and lancet in the proper receptacles. Then remove and dispose of your gloves and perform hand hygiene.
Okay? So you
As part of your follow-up care, assess the puncture site for any bleeding. Discuss the test results with the patient and give her a chance to ask questions. If she has been newly diagnosed with diabetes mellitus, encourage her to become an active participant in her own care as soon as she feels ready.
Okay? So yun yung sa blood glucose. Now, meron naman dito tayo guys, okay, sinasample, no? Pero since, yan, meron tayo dito. Pero kakakain mo na biyak na tasya. now, so doon na tayo sa susunod natin is your insulin. So meron ako ditong sample. I actually brought this, tinatawag ko kanina, I told you the insulin pen. No? This is the insulin pen. So nowadays, ito na yung ginagamit natin. Okay? So there are different kinds of insulin. Okay? May long-acting, short-acting insulin. Ang dati, nakahiwalay siya. Okay? Ngayon, may cartridge, we call this the cartridge, tapos nandito na sa loob yung insulin. Noong unang panahon kasi, ang ginagamit is, nakaseparate yung insulin, nakaseparate siya. No? Noong unang panahon, nakaseparate yung, kunyari, ito yung insulin, tapos may separate na bottle for insulin, no? Ganyan siya. Okay, yung nung time na yun, mas malaki ang chances na mag-overdose ka ng insulin. Again, ano nga insulin? Anong ginagawa niya? Binababa niya yung blood sugar. Yun yung mataas na tendency ng diabetic coma kasi masyadong madaming naipasok. Ito naman dito is very safe kasi i-arrange mo lang siya. Let's say for example, kung ano yung blood sugar monitoring niya, tapos say 100, let's say 125 to 150. Okay, 5 units of insulin lang ang ibibigay mo. So dito, maglalagay ka lang 5 units, no? Magagano ka lang. Ito may graduation to.
Set na yun po, bili mo.
Oo, set na to. Nasa 2,000 to 3,000. Okay? So, kunyari, sa mother-in-law ko to. Gaganan mo siya, kunyari. Yan, 1, 2,
unit.
Oo. Naiikot to ha, naiikot to. Yan. Kung ilang unit. Oo, automatic yan. Oo, tapos dito lang, no? So, halimbawa 2. Pag kunyari 2, pag pinras mo to, tok, babalik siya doon.
Mag-zero.
Oo, magsi-zero siya. Nagets?
Yes.
So, nakaano siya. Kumbaga,
Premix na yung
yes,
regular
nandun.
siya pa
Oo.
yung PTH na.
Nakaganon na siya. Nagets? Sasaksak mo na lang siya. And ito sa mga diabetic patients, sila na rin.
Sila lang.
Hindi na nila kailangan mag-prepare kasi dati pre-prepare ka pa eh.
Oo,
Kasi ang dami-dami mong needle. Ang dami mong needle na kailangan. Araw-araw, mamaya. Eh kung 3 times ka nag-check, 3 needle everyday ang pinutro mo. At least ito lang din naman. Ikaw yun. No, ikaw yun. Nagets? Okay? So ito, each patient, ikaw lang to. Now, meron tong, hindi to katulad ng ibang gamot na 1 year, 2 years. So, normally 1 month lang nag-expire to. So, tinatapon ko. Tinatapon ko siya. So, ito sa mother-in-law ko, kaya ko.
Ang exchange ma'am, yung doon lang ba na?
Hindi, tatapon na siya lahat.
Lahat.
Lahat, tapos bibili ka na.